Hi, my name is Michael Diminick. I'm an orthopedic surgeon in Lynchburg, Virginia. Another knee injury is a patella fracture. The patella or kneecap is on the front of the knee. This is a model of the knee. So here's the quadriceps tendon attaching to the patella, and then the patella tendon, which attaches to the tibia tubercle. When the quadriceps muscle contracts, it pulls through the quadriceps tendon, the patella, and the patella tendon to lift the tibia. If you fracture the patella, the extensor mechanism, that whole ability to extend and straighten out your knee, can be disrupted, making it difficult to walk. These fractures happen from a fall directly onto your knee with your knee bent, and as the fracture occurs, it's pulled apart by the quadriceps and patella tendons. If the bone is disrupted, where the bone is actually separated or displaced, you will not be able to extend your knee. If it's just cracked but not displaced, it might be possible to still extend your knee. So the treatment will depend on whether or not it's displaced and whether or not you can extend your knee. If you're able to extend your knee, then we can treat this non-operatively, usually with a knee brace that's locked in extension, meaning it's totally straight so you don't bend it and pull the fracture apart. You'd be in that brace for about 6 weeks, and then you do physical therapy after that. If the fracture is displaced and you cannot extend your knee, that will require surgery to get the bone line back up, and then we use screws and wires to compress the fracture so that the extensor mechanism is reestablished. After that, you'll be in a knee brace also for about 6 weeks, and then we'll work on physical therapy to regain your range of motion and to regain your strength. So it's a pretty substantial injury, and will take months to improve, whether or not it requires surgery or not. If you require surgery, there's certain risks with any surgery. So there's a small risk of infection. We'll give you antibiotics to help decrease that from happening. Loss of motion after the surgery is common, so that's why we're aggressive with physical therapy. You can still have some weakness and difficulty extending your knee. Again, another issue that's taken care of with physical therapy. And the hardware sometimes can be painful. If you feel your knee, it's just skin and bone. And then when we do the surgery, there's hardware between that skin and bone. So it can be very prominent. And in a substantial number of patients, they feel that hardware. So once the fracture's healed, if it is symptomatic, then we can remove that hardware with a second surgery.